This is Dr. Beatty. Hi everyone. Welcome back again to my channel. I know I haven't been making a lot of videos, but I prefer to make quality videos and interesting videos over quantity. So anyways, I'm here today to talk to you about a topic that a lot of people have been asking me, and that is for new interns going into residency, what kind of tips and advice I have for them. And so that will be today's video. So subscribe below and we'll get right into it. Okay, so just to give you a little bit of background, I did my first year, my intern year in internal medicine before going to anesthesia, and that's kind of, that's pretty normal and typical to do some kind of intern year for anesthesia in either internal medicine or surgery or a combination of different things. And so I loved my first year. My intern year was awesome. I learned a lot. I worked a lot. I made a bunch of really good friends, and so I only have really good memories from my internal medicine year. And so some of the things that I found really useful are the following. So I like to do things on the go, but I also like to have time to kind of review my patients beforehand. So before rounds, when I pre-round, I give myself enough time. If I have a bunch of sick patients on my list that need more time to be pre-opt or pre-rounded, I guess, I give myself that time. So get early to the hospital. If you're the kind of person who likes to dwell on details and really like to kind of, think about different things beforehand, before rounds, then I would say give yourself time, because you just don't know. Sometimes, you talk to a patient and 15 minutes has gone by. You only have like 15 more minutes to see 5 other patients, and so you really have to make sure you have enough time. The second one is always do a physical exam. I know sometimes if the patient has been in the hospital for 20 days, it's really easy to skip that part and be like, oh yeah, same physical exam as yesterday. But it's really important that you continue on doing your physical exams, because you just don't know what new findings you'll find. And it's just a more comprehensive way for you to provide medical care. And so that's what I would advise, make sure you do your physical exam on every patient. And you don't have to do head to toe physical exam. Obviously, you don't have that kind of time, and you don't need to do that kind of exam. So you do a focused exam on whatever disease process is going on with that patient. Okay, number three is really important, because this is where mistakes happen. Always double check your orders, especially as a new intern. It's very easy to order something that you don't mean to order, and usually the nurses will be able to catch it, but sometimes things happen and the wrong order gets to a patient and the patient ends up being harmed. So if you don't know something, ask your senior. Ask someone and say, hey, I've never ordered this, I've never placed this exam or this imaging. Like for instance, whenever I had a stroke patient, the stroke imaging order set is complicated. I found it really complicated. And so I would usually call the neuro team and be, hey, I'm placing an order for stroke. What are the orders that I need to place? And they will just tell you exactly what you need to know. There's no point of spending time trying to figure out an order set, because it's just not, for me at least, it's not worth of my time trying to figure out something on my own when there's specialists who do that all day long. And so that's my advice. Another advice that I have is listen to the nurses. So listen to your nurses. Don't dismiss them. I feel like sometimes you get calls that are just really annoying, and it's so easy to be like, oh my gosh, they're calling me again about this. But there's a reason why they're calling, and so don't dismiss those things and listen to your nurses, especially when you're working at nights. At night, you're covering 60, 70 patients sometimes in the hospital. You really are relying on your nurses' assessments to make a decision. And so always listen to them, don't dismiss them. On the same side too, though, when someone calls you and tells you, hey, there's something going on with this patient, or they have lower extremity edema, or their heart rate is this much, it's always a good idea to go see the patient, okay? Especially if it's a sick patient. I wouldn't make any big decisions from a computer. So go see your patient. make sure they're doing okay, do your exam again, and make a decision based on that. Okay, and then what else? Other things that I also would suggest is that for some people, I think internal medicine or other fields can become very tiring because you have a lot of patients, and then your note writing can take forever. And so I remember some patients had a lot of medical issues and would take like an hour to write their notes. And so if you have 8 patients, you can't spend 8 hours writing notes. So you need to have some kind of a plan to make sure you're writing your notes at a in a timely manner, so that other people and other physicians and other nurses, people who take care of this patient, can see your note, right? If you're seeing a patient at 9 a.m. or 10 a.m. and your note is only signed at 5 p.m., then it's like, okay, how are the rest of the team supposed to know what's going on with this patient if you haven't put your note in, right? And so what I usually do, or what I did, was when I pre-op in the morning, I'll go in, I'll print out the sheet of patients that I have. On that sheet, there's usually their main medical problems, and I'll only jot down the things that have changed or that are new, and I'll write out all the new vitals and all the new labs, any new imaging, or any kind of new results that they have, and then change my assessment and plan from the previous day based on that, okay? And then at the same time, when I do that, I write my notes. So I start my note. I start the template, and I change the subjective and the vitals. I change some parts of the assessment that I think is gonna change, and I penned the note on the computer. So that's penned. So all I have to do after I'm done rounding is go into those notes and adjust anything that needs to be adjusted, and I'll be done, and I'll be signing it right away. So I would say when I was an intern, almost always my notes were done by at least 11 a.m. or 12 p.m. So, I just found that it's one less thing for me to worry. I hate having a long to-do list. And so that's already done, and I can focus on my new patients that I'm going to be admitting and so on. Okay. Those are the main, I feel like those are the main, advice I have. Again, if you are in a situation where you feel like you're not comfortable, taking care of patients for some reason, like, if you feel like a situation is not very comfortable, you've never done this before, you don't know what to do, it's always good to phone a friend. So phone a colleague that it can be another resident, it can be a senior resident, it can be your attending, and ask them their opinions on it, instead of making a rash decision on something that can be critical. And then again, if you really have a precise question for a specific specialty, then I would just call that specialty and say, hey, I've never done this before. This is not a formal consult. I just want to know, is there anything else that we should be looking at, or is there anything else that I should be ordering for this patient? And so that's pretty much it. I hope this is helpful. And I really hope all the new interns who are starting in June, I think, or July, all the luck. You guys will do great. My first time as an intern, my first day, my pager broke, like it literally shattered on the ground. And I felt like it was the end of the world. And so things will happen. You feel like you're not doing anything right. You feel like you're just like drowning sometimes. You feel like you're a terrible doctor sometimes, but trust me, trust the process. You'll be just fine. Just learn as you go. Listen to your attendings, learn from your attendings, learn from your seniors, and then learn from your patients as well. And so I hope you guys found this useful. If you did, please subscribe. I'll have more videos like this on just training in general, and just for patients in terms of learning about anesthesia and other things. All right, okay, bye everyone.